What's the best way to help with concussion symptoms and cervicogenic headaches and neck issues that you'd normally see a chiro for? Unfortunately, a lot of what you would need in terms of neck work requires some hands-on and manual work that normally a chiro would do, or a massage therapist, or some PTs would do as well. But there are still things you can do. Most of it is things like exercise, stretches, stability exercises, and proprioceptive exercises, depending on what your symptoms are. If your symptoms are mostly headache based, usually that requires some soft tissue release or tension release. You can do this with rehabilitative exercises, but it does take longer. But the good news is once you get it there, typically the results may be longer lasting. So it depends on what your issue is. I don't want to give you any recommendations without knowing what your specific issue is. It's not like there's just general recommendations, but I would look for stability exercises, typically isometric based exercises, working on the deep neck flexors, which are here in the front, usually things like chin tucks or driving your head back into the wall or into a ball or onto the floor, and then lifting your head up slightly. That's usually how you work the deep neck flexors. You can do lateral isometric stuff where you're either pushing against resistance, either self-resistance, or you can get an exercise ball, put it on the wall, and push into it laterally like that. You can also do it lying on your side and lifting your head up slightly and just working on the side of your neck. You can do it from a prone position to work the muscles in the back of your neck. You can get little lacrosse balls or tennis balls or acupressure balls and put them up in the suboccipital area and push your head back into them to create kind of some of that soft tissue release. It really depends on what the issue is, and without knowing that, I don't necessarily want to just tell you to do everything, but if you have a healthcare provider you're working with right now, a lot of them are doing virtual, so I recommend maybe booking in with them and having them give you specific exercises for what you need.